If you have had surgery, you may remember that we started counting backwards from 10. Then you wake up and the surgery is already over. You may look asleep, but you aren't. You were under anesthesia, which is much more complicated. You were unconscious, but you couldn't move, make memories, or, hopefully, feel the pain. Without being able to block all these processes at once, many surgeries would be too traumatic to perform. Ancient medical texts from Egypt, Asia, and the Middle East all describe early anesthesia. Today, anesthesiologists often combine local, inhalational, and intravenous means to find the right balance of maneuvers. Local anesthesia blocks pain signals from certain parts of the body from entering the brain. Pain and other messages travel through the nervous system as electrical impulses. Local anesthetics work by erecting an electric barricade. They bind to proteins in the cell membrane of neurons and let charged particles go in and out. One compound that does this is cocaine. The analgesic effect was accidentally discovered when an ophthalmologist put some on his tongue. However, in the case of major surgery that requires unconsciousness, you want something that affects your entire nervous system, including the brain, such as an inhalation anesthetic. In Western medicine, diethyl ether was first used. It was first primarily known as a recreational drug, until doctors started noticing things that sometimes people don't realize they are injured while under the influence. In the 1840s they began sedating patients with ether for tooth extractions and surgery. Nitrous oxide then became popular in the next decades, and it is still used today. Although ether derivatives such as sevoflurane are more common, inhalation anesthesia is usually supplemented with intravenous anesthesia. A common intravenous drug is a sedative such as propofol, which causes unconsciousness. Opioids such as fentanyl are given to relieve pain. General anesthesia seems to work by affecting electrical signals in the nervous system. Normally, the brain's electrical signals are a chaotic chorus because different parts of the brain communicate with each other. This connectivity keeps you awake and conscious, but if someone gets drugged, these signals become calmer and more organized. Different parts of the brain seem to not talk to each other anymore. There's still a lot we don't know. What we do know is several common anesthetics bind to the GABA receptors on neurons in the brain. This allows negatively charged particles to enter cells. Negative charges accumulate and become like a traffic jam, which prevents neurons from transmitting electrical signals. The nervous system has many of these gated channels which lead to control of motion sequences, memory, and consciousness. Most anesthetics are likely to have multiple effects, and they act not only on the nervous system. Many anesthetics also act on the heart, lung, and other vital organs. Therefore, the anesthesiologist must formulate the appropriate combination of drugs, while carefully monitoring the patient's vital signs. Anesthesia is complicated, but it has made possible the development of new and better surgical techniques. Subscribe for more medicine and health discussions.